Hello everyone, I'm Turcica and today I'm going to demonstrate the Sella Turcica Towne method, Haas method, which is the PA axial projection, the PA projection, and optical canal foramen Rhese method, Pareto orbital oblique projection. So this is now the Sella Turcica Towne method. So position description, the patient is in the supine position, which is the OML and IOML and MSP perpendicular to the IR. And the central ray entrance is 2.5 to 3 inches above glabella, 30-degree caudal, 37 caudate. So the image evaluation, cellar region, 30-degree caudate, the dorsum sellae, tuberculum sellae, and anterior clinoid processes through occipital bone above shadow of foramen magnum. 37 caudate, dorsum sellae, and posterior clinoid processes within shadow of foramen magnum, and the symmetric petrous pyramid. So this is now the Haas method, which is the page projection. So the patient is in prone position. The MSP and OML is perpendicular to the IR. Forehead and ear nose against the table. The IR is center 1 inch to Nishon. 25 degrees cephalad to OML 1.5 inch below inion or the entrance, and the 1.5 inch superior to Nishon, the exit. The image evaluation is the dorsum sellae, posterior clinoid processes within the shadow of foramen magnum, symmetric petrous pyramid. So this is for obtaining image of cellular structures within FM1 hypersthenic and obese patients. So now this is the Sella Turcica PA projection. So the patient is in prone position, forehead and ear nose against the IR. MSP and OML perpendicular to IR, and the central ray is in the 10 degrees cephalad to glabella. So the image evaluation is the dorsum sellae, tuberculum sellae, anterior and posterior clinoid processes through frontal bone above ethmoidal cyanosis. So let us now demonstrate the optical canal foramen Rhese method parietal orbital oblique projection. So the patient is in the prone position, affected orbit closest to the IR. Zygoma, nose and chin against IR, 3 lower landing. AML perpendicular to IR, MSP 53-degree angle to IR. So the central ray here is perpendicular to affected orbit closest to IR. So the image evaluation, optical canal or the foramen, inferior and lateral quadrant of orbital shadow. So the prone affected orbit against IR, and now this is the optical canal foramen Rhese method parietal orbital oblique projection.